have watched our earlier video before anxiolytic, it is better, because we will be discussing in the CNS disease. So please refer to our CNS basic CNS video and as well as hyperpolarization video. These two videos are very extremely important to discuss the term known as anxiolytics. Okay. Now before you start with anxiolytics, you must know. We must know these two terms: sedatives, okay, and hypnotics. These are the important terms in anxiolytic. Now, what are sedatives? I have explained in my hyperpolarization video. The sedatives and hypnotics both have CNS depressant activity. So you can say that sedatives are CNS depressant. First thing, they are CNS depressant, and I hope I have mentioned that this depressant is totally different than the mood depression. Okay, so CNS depressant, and why they are CNS depressant? Because they are acting on GABA A chloride channel receptor, which is ionotropic or ligand gated receptor. And I have explained there are two allosteric sites, that is barbituric acid, barbiturates, and benzodiazepine. So now the sedatives at lower dose, can act as hypnotics. Okay, so hypnotics are the agent which induce sleep. Okay, so any person having the problem like insomnia, okay, they can be treated with the mild dose of hypnotics, and the same drug at a higher dose can be act as sedatives. Okay, now what? So definitely the CNS depressant activity of sedatives are more powerful because they produce dose dependent depression. Okay, and what is the use of sedatives? The sedatives are primarily used as anxiolytics. Okay, they can be used to treat epilepsy, so anti-epileptic. Because if you know, I have discussed in my hyperpolarization part 2. Those who have taken admission in a Growwell video class, they will be getting that. In that over, I have explained that when depolarization of sodium channel takes place, abnormally, and that leads to firing of all neurotransmitters, and you can prevent those fire, okay, by giving GABA agonist, which can reduce the firing by hyperpolarization. Okay, this all I have explained over there. Now anti-epileptics and also sedatives can be used as you can say pre-anesthetic medication, and some of the sedatives can be also used as IV anesthetics. Okay, IV anesthetics. So these are the important news. Of course, these are the all Schedule X drug. I'll be discussing Schedule X strictly given only by the prescription. Okay, and I'll be explaining my jurisprudence video. Already I have explained some of the basics, but I'll be explaining when I'll be talking about narcotic and psychotropic substance. Okay, and these are the all drugs having black box warning. Black box warning means it can promote a suicidal tendency. Okay, so that's why these drugs should be used with a cautious and with a proper dose. Okay, so let us discuss the various types of sedatives. Okay, various types of sedatives, hypnotics, because both classes are same. Okay, at the lower dose they can act as hypnotics, and higher dose. Now the first one is type 1, the barbiturates, barbituric acid or barbiturates. Now these barbiturates, if you remember the diazepam or benzodiazepine mechanism of action, they act on allosteric site of GABA receptor and they bring conformational changes which hold the GABA for longer time. But over here barbiturates can enable to open the GABA A chloride channels by itself, and that can promote chloride influx, which can lead to hyperpolarization. So barbiturates sedative potentials are high, and that's why sedative related side effects also high in barbiturates. So long duration over 6 hours drugs of barbiturates are methylbarbital, mefo, and the phenobarbitone. Mefo-barbitone, phenobarbitone. See, barbitone means ketone and barbital means aldehyde. Okay, that's the only difference. Then we have intermediate acting 3 to 6 hours, amo and butabarbital. Amo and butabarbital. Okay, these are the intermediates. Then you have intermediates after that, short acting, which is less than 3 hours, that is pento and secobarbital. Pento and secobarbital. Okay, and the ultra short acting less than 1 hour, that is your thiopental sodium. Thiopental sodium. Why it is ultra short acting? Because if you remember our biopharm video, the drugs having high volume of distribution, they tend to be very less amount in the blood. Okay, and that's why they may be diffused, and that's why within less than 1 hour their action persists, and then after that it get diffused. So thiopental sodium can be also used in IV anesthesia, IV anesthetics agents. Now after that you have a next class of drug, number 2, quinazoline. Now these drugs can be also having some potential anti-cancer activity. That's why people not much use them, because all anti-cancer can also induce cancer. Okay, that I will be explaining in my cancer video. You have methaqualone. Okay, methaqualone, a drug. All the qualone drugs are coming to the quinazoline derivative. Okay, now coming to very important class of drug, number 3, sedatives, hypnotics, which can be, the sedatives can be used as anxiolytics, that is your benzodiazepine. Okay, benzodiazepine. Okay, now what are the drugs? The first thing is, we should not, or the pharmacist should advise doctor that they should not recommend these drugs beyond 2 to 4 weeks. If 2 to 4 weeks this drug taken, then it can produce lot of sedative dependent side effect that I will be discussing. So first let us see T-half. Okay, so 2 to 3 hours T-half is with the drug known as triazolam. So this is having more hypnotic potential than sedative potential. Now when we go ahead, we have 10 to 20 hours T-half, that is belongs to lorazepam and oxazepam. Lorazepam and oxazepam. So in this case, it is going towards little sedative because the T-half is more, the potency is more. Then you have 12 to 15 hours alprazolam. Again, this can be in mild dose. Alprazolam can be used to induce sleep as a sleeping pill, very popular, but it is strictly Schedule X. Then 20 to 40 hours. Then you have the drug known as diazepam. Diazepam can be given to treat epilepsy, that I will be discussing in my epileptic video. Many of the diazepam, it is banned in many other countries, but in India, Korea, US is totally different. That we will be discussing in regulatory affairs. Okay. Then 15 to 40 hours. Then we have 15 to 40 hours again. It is chlordiazepoxide and nitrazepam. Chlordiazepoxide and nitrazepam. Nitrazepam. Okay. Then you have T-half, highest 40 to 100 hours.